The first icon in the export section is the show the patient analyses. Now, when presenting a patient with a treatment plan, you simply would go ahead and use the MPR views and present the patient with your treatment plan. But if you desire to show an alternate treatment plan to your patient, this is when you would go ahead and select Show Patient Analyses. You would be presented with the initial scan, initial plan, but then you are given an option to go ahead and create a duplicate patient analyses. So you're duplicating the data, the raw data. You're also, of course, able to then name that analyses and enter a comment about it. And once you've clicked OK, then you're presented with two different analyses, two different copies. If you want to show the patient the alternate treatment plan, you would select the copy. You would go ahead and click OK. This would then open up the same image, but a copy of it. And you can present your patient then with your alternate treatment plan. And they're both saved. So then you can go back and forth at any time. Simply go back to click on Show Patient Analyses, and you will see if you'd like to open the initial or the secondary analyses. The patient analyses allows you to save the views and the settings for patients, including any drawings, measurements, or implants. The next tool we'll talk about is the camera looking icon. And this allows you to take a screenshot of your current workspace. So display for your patient and what you'd like to do, make your measurements, place your implants, and if you'd like to take a screenshot of that current space, you simply would go ahead and click on the camera icon. Two things I would strongly recommend is, first, go up to the upper right corner, select your preferences, and then select your camera icon. And when you do, then you're able to choose the format of your choosing or of your liking, select that, click apply, click OK, and now on this particular workstation, from that point on, all the screenshots will be taken in that format. The second thing I would advise you to do is click on the gallery option in the bottom left corner. This will open up a thumbnail view of all of your screenshots. If you have a desired display on the screen that you would like to take a screenshot of, you simply go ahead and click on the camera icon, and you will notice that, just give it a second or two, but that screenshot now has appeared in the bottom in that gallery view. So it's good to know that something is happening. By having that gallery displayed, you are able to see that you have in fact taken a screenshot. If you have a need to take a screenshot of a particular window, you will notice there are icons above each one of these pictures. The very first icon looks like a floppy disk, has a drop-down arrow next to it. When you click on that drop-down arrow, you're presented with a camera icon as well. So by clicking on that camera icon, you are then acquiring or taking a snapshot of or screenshot of just that one particular window. Now, if you desire to do something with those screenshots, you should go ahead and look back at the export section here. There's a folder looking icon, and that will open up your screenshot directory. So when I click on that, it will open up a window that has all the screenshots I've taken up to this point. Now, as you can see, you're able to rename these. Simply right-click, rename. You're also able to display the view. So if your screen does not look like this, feel free to right-click and change the view. You can display details, for example, so that you can see the date and time. You can also right-click, display large or extra large icons, so you can see what your screenshots look like before you do anything with them. Now, because these are regular pictures now, you are able to then send them in an email to somebody, to another doctor. You are able to import into another software. So treat it like any other picture. Another icon I would like to go over is how to burn this patient file to a CD or to a USB. And the icon I'm describing is actually looks like a CD. So if you are interested in burning this image to a CD, you simply would insert that CD into your computer. Give your computer a second to recognize that there is a disk in there, and any type of disk will work, CD or DVD. Or then you would go ahead and click on the icon that looks like a CD. And once you do click on it, again, depending on the size of this image, but be patient, give it a few seconds. And the next window will come up that will ask you to name the disk. So you simply would type in the patient's name, you would click next, and then you would go ahead and you'll notice that it will burn this entire image and it will burn this entire software and put all of it onto that disk so that it can be viewed by another doctor or any other location. When you're ready to burn an image to a USB stick, you would click the drop down arrow that's directly below the CD looking icon, and you are then presented with an option that looks like a USB stick. So at this stage, then you would go ahead and insert the USB stick into your computer. You would then actually click on the icon to export. You can create a new folder, and I have created one that has a patient's name. So click on new folder, create, name it whatever you would like to name it, click OK, and the software will once again burn this entire image and the viewer, the 3D viewer, to that USB stick.